So the major contributing factor to fatty liver disease is too many refined carbohydrates. And maybe you just both want to expand on that, and then we'll look at other factors that are causing, the problems with glucose control, type 2 diabetes, and insulin resistance.
Yeah, I mean, we've seen a huge increase in that. There's no doubt. We've also seen a lot of data looking at hyperpalatable foods, ultra processed foods. So we know that all of these foods typically tend to be very high in carbohydrates. And we're not talking about the good carbs, right? Obviously, we're talking about carbohydrates that have been stripped, that have a huge impact to blood sugar and insulin. I often refer to my patients as, you don't want to have a roller coaster that's really, really steep and really, really steep down. You want more of kind of a roaring hill that's a little bit more normal, and it's less from an inflammatory standpoint. So from the refined carbohydrate standpoint, it again depends on where the severity of the disease is. For some of my patients, I just want them to moderate carbohydrates, take out really the crud that has no nutrient density, nothing tied to fiber. And that really is a great solution. And then bringing down drinking, exercising, et cetera. For other patients, they even have to take down healthy carbs a little bit. So just, again, it depends on how long they've had the disease. It depends on the severity. I would say for most people, we can really find a great solution simply by looking at any carbohydrate that does not have fiber attached to it, taking that out and replacing it with a healthier option. So that's really where we kind of get into the bones of things with patients, is how do we take what you're currently having? How do I take your pretzel and give you a better option that you still enjoy, that you don't feel deprived, and that you can maintain long-term?
Okay. Dr. Ibrahim, any other comments there?
I can comment on another risk factor, which is major risk factor for fatty liver, type 2 diabetes. And I will let's start by quickly telling you about a study that was done in Southern California in the diabetes clinic. It's not a liver clinic, it's a diabetes clinic. Patients were coming in to get their diabetes checked up and managed. They have no history of liver disease. They've never, ever been told that they have liver problem, right? And they have no symptoms, certainly, of liver disease. And everybody in that clinic, they said, we're going to screen you for fatty liver. We're going to do an MRI picture of the liver. It's called MR elastography, which is a fairly good test to find out if you have fatty liver disease and how much fatty liver or damage you have in your liver. So everybody got MRI. And the results were astonishing. Number one, they found that 65% of those patients have fatty liver disease. So if you do have type 2 diabetes, you're more likely than not, you have fatty liver disease. But what's really interesting from that study, 7% have significant scarring in the liver at the edge of liver cirrhosis. So on the scale of 0 to 4, with 0 is no scarring in the liver, no fibrosis, and 4 cirrhosis, they were at 7% were at stage 3 to 4. So think about that for a second. We are talking about a patient with type 2 diabetes, never ever been told that they have liver disease. They have no symptoms of liver disease, and 7% of them have cirrhosis of the liver. They've never had any problem with drinking, never had any problem with their liver, and they have cirrhosis of the liver related to fatty liver and type 2 diabetes. As a result of that study and many other studies, the American Diabetes Association came out a couple of years ago now, and they said, if you do have type 2 diabetes, you got to be screened for fatty liver, even if you have no symptoms. And screening, like we said earlier, would be blood test and picture, some kind of picture of the liver with ultrasound or MRI or something. So I think, the take-home point here, type 2 diabetes is a major risk factors for fatty liver disease, in addition to what Kristen obviously said, the increased carbs intakes and refined sugar intake.